Oh my God, ITP. This is a more complex class. It might take a little more time. I would like you people to kindly pay attention. What happens over here is this is a mass of tangled fibrin caused by the various clotting factors and the platelets. What happens there? RBCs also get enmeshed within it, and there is a thrombus that is being formed. Externally, it is a clot. This is a group of disorders that come under purpura. Purpura means you find that there are fine spots of spontaneous bleeding in the mucous membranes and the skin. It can be because of vasculitis or thrombocytopenia. Small minute dots are called as purpura. Then comes petechiae and sometimes blotchy lesions. See this large irregular map-like areas. These are called as ecchymosis. Any of this can occur in vasculitis and thrombocytopenia. In this class, I shall be concentrating on idiopathic thrombocytopenic purpura. So this is due to the production of antibodies. So it is otherwise called as autoimmune thrombocytopenia or immune thrombocytopenia. ITP can also mean immune thrombocytopenia. It is due to platelets having antibodies against them. And it has been proven by all these facts. Infants born to ITP mothers develop a thrombocytopenia because of the antibodies. Patients, when they are transfused, they can develop. Normal platelets, when infused into ITP patients, they are also destroyed. And ITP is sometimes diagnosed with other autoimmune disorders. There is a condition called as opsonization, coating of the platelets with the antibodies, after which it is susceptible to phagocytosis. See what is happening over here. This is a platelet and it is getting sensitized. There is a production of the antibodies. It has got antigens on the surface, the antibodies cross-link and they get attached to it. Once it is like this, there are certain receptors even on the phagocytic cells. They get attached to the antibodies and there is a phagocytosis or a sequestration of the platelets. This you people shall and will write. The highlights I have already mentioned. The duration in acute ITP is, it is of a short duration. Children are more affected. And there is a past history of viral infections. Maybe because of that, antibodies have been produced. Antiplatelet antibodies are IgM. And there is a reduced platelet count. Most commonly children 2 to 6 years of age, sex is equal. Following viral infection, purpuric spots or ecchymosis in the legs can be present. Other regions are GAT and respiratory system where there can be bleeding and it is self-limited. This is a very important chart, line diagram, which I would like you people to draw. It has been compiled by me and so it is extremely important. In this, I find that there is autoimmunity, antiplatelet antibodies are being produced. There is the opsonization of the platelets and also you find that antibody-specific suppression of the platelet precursors can occur in the bone marrow. These are being destroyed by the reticuloendothelial cells of the spleen, liver, etc., leading to a thrombocytopenia. Also, you find that lifespan of the platelets is reduced in the blood. The bone marrow attempts to produce increased amount of platelets. Therefore, immature megakaryocytes will be increased in number in the bone marrow. I mentioned earlier that one of the classical conditions, indications for bone marrow aspiration is ITP. There will be a tendency to bleed, mucus bleeding, etc. can be there. As I told you, petechiae will be small, purpura 2 to 10 millimeters, ecchymosis will be more than 10 millimeters. I would like you people to kindly memorize and draw this one. And this is a summary and the differences between the acute and the chronic ITP. So highlights I have just shown you. What will be the blood picture? Obviously, there will be a reduction in the platelets. RBCs will initially be normal, but later on, due to repeated bleeding, the patient can develop an iron deficiency, anemia, microcytic hypochromic cells can be there. Occasionally, there can be giant platelets. There will be A normoblastic maturation, main importance will be the megakaryopoiesis. You find that there will be immature cells of the megakaryoblast. The budding and the production of the platelets will not be there. Other cells are normal. Specific investigation will be, you will have to look for antiplatelet antibodies such as 2B, 3A glycoproteins. Now this is the tabular column showing you the difference between the acute and the chronic ITP. So kindly memorize this one. So peak incidence 2 to 6. Chronic, it is in older age. Sex predilection nil. Whereas here it is 3 to 1, female is to male. Viral infection common in ITP, acute, whereas it is unusual. Bleeding is abrupt, it is insidious. Count can be as low as less than 20,000. Here is 30,000 to 80,000 per microliter. Eosinophilia and other lymphocytosis can be common because it is immunological. Duration, self-limited. It can be for a long duration, for months and years. Remission is spontaneous, it is uncommon. Kindly memorize this particular tabular column. Thank you.